The leader of the delegation, Deputy Director, Center for Strategic and International Studies, Washington, D.C., Richard Downing, said what he saw on ground in Ondo State was surprising, contrary to what is widely believed in the United States. Aside giving assurance that the CSIS will introduce the maternal mortality program of Ondo State government to other countries, Richard Downing declared that other states in Nigeria should take a cue from the achievement of the Ondo State government in this regard.
What strikes me as really useful and informative is the fact that, first of all, free healthcare is being provided for some of the most needy members of the community, so for mothers and for young children. I've been impressed that there's a system here that allows the health care system to work, to function properly and efficiently. So often back in Washington, there's a view that Nigeria has so many problems, that there's too much waste, there's corruption, that the US spends an awful lot of money on health programs in Nigeria, and sometimes they don't get the expected or the hoped for results. So importantly, it's important to highlight what's working well, to go back and say, well, no, there are pockets of good practice here in Nigeria.
The Commissioner for Health in Ondo State, Dr. Dayo Adeyanju, told journalists that the various programs in health sector in Ondo State has been designed in such a way that the present economic meltdown cannot affect them.
And then, of course, we have to construct extremely new infrastructure. So for now, recurrent is not as expensive as when you put in a new one. And so we're going to look at the community-based health insurance, the universal health coverage, as a way of ensuring that we pool funds together and share it in a way that everyone can have access to.
The delegation was shown around the two mother and child hospitals and some improved health centers in Akure and Ondo City, including a trauma center, which is unarguably the best in Africa.